Hey, everybody, welcome back to another episode of Between Sessions with Berries. I'm excited to have our guest today. He has a super interesting story and bio, so I'm going to tell you guys a little bit about him. Today's guest is Dr. Pedro Morante, a globally recognized mental health leader, educator, and entrepreneur. He's the clinical director at Psych Mental Health Services and the founder of PASS, a review center that empowers future nurse practitioners through strategic exam preparation and mentorship with advanced training in precision psychiatry, pharmacogenomics. I was worried I was going to mess that word up. Pharmacogenomics and trauma-informed care. Dr. Morante is shaping the future of both clinical practice and mental health education. If you're curious about how to avoid burnout, manage anxiety, and maintain long-term success in the field, you're in the right place. Dr. Morante, Pedro, welcome. You've accomplished so much. I'd love if you could just tell us a little bit about yourself and what inspired you to enter the mental health field with everything that you're doing and then turn it into education and then evolving into entrepreneurship. Let's just talk about all of it.
My name is Pedro Morante. I'm based here right now in Los Angeles, California. And my dream and passion was all about mental health programs with my deep belief that true success begins with emotional being. So I understand
Nice.
the struggles between my students and my patients, that they cannot reach their full potential without proper support emotionally, mentally, and psychological help. So that drives me to have a full commitment for creative programs that are compassionate, practical, and are results driven. I'm very passionate about breaking stigma around mental health and making support available through education, mindfulness technique, skill building, and structured accountability.
Wow, you're doing so much. So you're leading clinical programs, you're mentoring the next generation of nurse practitioners. What keeps you connected to this work on a personal level? Like what drives you to really be doing this?
The first curiosity was always on the human behavior and a deep respect for people's stories. So early on, I saw how untreated anxiety, trauma, and burnout quietly shape academic performance, career choices, and the quality of life. So my journey evolved into education and entrepreneurship because I realized that knowledge alone is not enough. People need structure, mentorship, and emotional support to truly succeed.
Mm,
Education became a way to scale impact, and entrepreneurship allowed me to build programs that meet clinicians where they actually are. And what keeps me motivated and connected on a personal level is very simple. I see myself in my students. I remember the
mm,
pressure, the self doubt, the fear of failure. Mentoring future nurse practitioners isn't abstract for me, it's very personal. And
mm.
every conversation and every breakthrough reminds me why this work matters to me.
Absolutely. Now, burnout, right? Burnout is so common among high performing clinicians and educators. How have you personally navigated this? And how is that translated into the work that you're doing with other nurse practitioners that are just starting out and, worried about the testing and all of that?
Great. Thank you so much. This is a very good question.
Thank
So,
you.
burnout is incredibly common among high performing clinicians and educators because we're often rewarded for self sacrifice. Personally,
Mm,
I had to learn the hard way too. And sustainability that requires boundaries, intentional rest, and redefining success are very important. What I've seen work best for others is normalizing limits. We always like to say, yes, yes, I can do it. But sometimes it's okay to say no. And
mhm.
building supportive communities and treating mental health maintenance as non negotiable, not optional. That's very important. And with
Absolutely.
clinicians too, staying longer with their work because of documentation. And that's why AI had given us an opportunity like the berries that we were going to talk about and
Mhm.
collaborating in the future will be a good important thing that can reduce the burnout syndrome that a lot of clinicians are experiencing. And with stress
Absolutely.
anxiety and performance pressure on the exam, I see these recurring patterns of catastrophizing, perfectionism, and trying self-worth for outcomes. And many students believe if I fail this test, I fail as a person. So helping them move it starts with reframing, teaching them to separate identity from performance, and giving them concrete tools to regulate their nervous system, build mastery through repetition, and regain a sense of control during the exam.
Yeah. Nice. So could you tell us about PASS, like how it works and sort of the testing that you help them with? Because I'm a licensed clinical social worker, so I'm not as familiar with the nurse practitioner world and the testing, but I would love to just hear about PASS, and it's PASS, all caps, just in case you guys are wondering. Could you tell us about that and sort of, the way it helps a clinician if they're just like starting out and they're like, I know I've got to take this test. How does PASS help?
Sure. So, as mentorship, PASS stands for Peter and Associate Specialist School. So
Um,
we are board preparation courses program, and we offer also CEU programs for LVNs, RNs, nurse practitioners such as family nurse practitioner specialization, psychiatric mental health nurse practitioner specialization, AGNP specialization. And basically what we do is we work closely with the students to ensure that they will get their board certification and succeed through
wow.
those big certification exam. So they always have test anxiety, which is normal. But if this is not managed, it can hinder your success on performing on the exam. So we work through anxiety management, we work through study structure, and we work through confidence building for them and making sure that they pass. And most importantly, they stop seeing themselves as broken. That shift
Yeah.
in perception is the real win for us.
Amazing. Yeah, because I wonder just, anecdotally, like somebody that is needing to pass the board certification, how much time do they need to set aside to be prepared, like studying and, confidence building and all that stuff? And do they tend to take it more than once? Like, is there a high fail rate? Like, I'm just curious about for nurse practitioners, because I know LCSWs and licensed, mental health, like there's a lot of fail rates with the testing, and it can cause so much anxiety, like you said, and confidence issues and that sort of thing. So I'm just wondering, like, what do you recommend with PASS? Like, how long should somebody wait? Should they start preparing and doing the mindset stuff?
Great, that's very important. So failing the exam doesn't define the students, but it's just there are different factors that affects their test performance. Probably
Mm,
test anxiety, or probably they're not so familiar with terminologies that are, and also the unfamiliarity with the blueprint of the exam. So it's really important to first circumnavigate those barriers so that we can be successful with our exam. So the proper guidance and the proper support and structure is really needed when you're trying to take certification exams. So what I noticed also is that if the student is not preparing enough, or just had the mindset that I can take this test and then fail and then take it again. The mindset is you really need to prepare for this exam. Like at least 90 days is a very
mm,
conservative days that you can prepare for the exam. And some students prepare while they're in the program, which is very good. But I think 90 days that after finishing your program, according to research, is the ballpark wherein a lot of students are successful. But past 3 months or 90 days, the first attempt success rate may be lesser than usual without proper preparation. And that's why we're here to bridge those gap and make them successful with it.
that's amazing. Yeah, I mean, I feel like you've got to do it while you're still fresh on the material, because if you wait too long, it's like, then you're out in the real world and you're probably forgetting half of what you learned in school. I know for me that was definitely the case. So that's good. That's a great recommendation. That's fantastic. So shifting a little bit, because you talk about a lot of stuff. I went and like went through your YouTube, your Instagram, and all that stuff just to learn more about you, because I was super interested after reading your bio. You talk about something called the 5 M's of mental health. Can you walk us through what those are and how they help with resilience and longevity in the field? Because I know you're a teacher and all that, but you're also a clinician and you help people with mental health issues. So could we talk about maybe what those 5 M's are and how it helps with resiliency and longevity in the field?
Thank you so much. So I teach the 5 M's of mental health. and I
Yeah.
will start it. It's mnemonics or acronym that stands for number one, movement, number two, mindfulness, number
Mm.
three, mastery, number four, meaningful engagement, and then number five is Mediterranean diet. So,
I love that.
yes. So together they create a framework for resilience and longevity. So let's start with movement. As we know, movement regulates stress. We're producing our normal enkephalins, endorphins if we do exercise. So I teach my patients that mobility is a very important way to combat or decrease anxiety and depression. And the
Mm.
more we are active, the more that our body produces those happy hormones and also our enkephalins and endorphins, which makes us feel good. So 30 minutes brisk walking could be good. And also running or any activities that they try to enjoy. The next one is mindfulness. This is a grounding technique for us to be present in the moment. So
Mm.
we don't overthink about our past and we don't overthink about our future. So staying in the moment means staying present at all times. So that will keep us grounded with our mental health. Number three, mastery. When I talk about mastery to my patients, I tell them this builds confidence through skill development. So any job or skills, hobbies that they try to enjoy, either they like gardening, what else,
Mm.
going to the park, taking care of their dogs, or a job that they enjoy, is very important for us to produce more fins and capillans, which makes us also in alignment with our mental health. The next one is meaningful engagement or meaningful connection with friends and family. This is very important, especially that we're in the holidays right now. Connecting with your friends and family, sending them a text, calling them, it could be Zoom. If they're far or they're out of the country, we can do so much to connect with people that matters and are good for our mental health.
Mhm.
Number five is your nutrition. This is very important as we know that nutrition has something to do with our gut supporting mechanisms, providing us the biological foundation for our mental health. So they have
Mm.
found out that Mediterranean diet is one of the diet that we could always utilize to improve our overall mental health. So for providers juggling clinical work, leadership, and education, these are strategies that we can utilize for them and also set a time for recovery time, like scheduling meetings and setting realistic expectations and limiting cognitive overload and staying connected with purpose. Mental health protection isn't about doing less, it is about doing what matters with intention.
Absolutely. I love that so much. And I think it's more obvious now, but back when I started out in the mental health field, like there was no talk, even with doctors, there was no talk around gut health and like nutritional health, really. And now, I mean, the impact of just like having a healthy gut and the effect on just like brain fog or not having brain fog is huge. And I like hearing you say that about the Mediterranean diet. And I wonder, like, do you have a favorite meal, like Mediterranean meal that you is a go-to for you, for somebody that might be listening is like, I want to get into that Mediterranean diet. What would you recommend?
So,
Anything?
yeah, so all the foods that are high in olive oil or fatty fish, I love it.
Mm.
And
Yeah.
fruits and vegetables, nuts and seeds, those are very important to lower systemic inflammation. As we know that there are some ruling out that there is an inflammation aspect which makes our brain to be foggy more than usual. And they really support our brain health, like fiber-rich plant foods, can also be beneficial for gut bacteria, and a healthy microbiome produces neurotransmitter precursors and anti-inflammatory compounds that influence our mood, our focus, and our cognition. And they also stabilize our blood sugar. So make sure you avoid foods that are all high in starch and over refined carbohydrates and added sugars. So the Mediterranean diet can help prevent sugar spikes and crashes as one of the most contributor factors for brain fog and afternoon fatigue.
Mm.
And healthy fats and antioxidants, which supports the vascular health also because they can improve oxygen and nutrient delivery to the brain, which enhance alertness and mental performance. So the key
Mhm.
is getting foods that are high in B vitamins, magnesium, omega-3 fatty acids that are essential for our energy production, memory, and cognitive and executive functioning.
It's so important. I feel like we can't even say that loud enough, especially for clinicians, right? I mean, because you're helping clinicians and improve their mental health so they can stay stable and then not burn out and not, and still be able to help people out there in the world. So, just starting with a basic diet and exercise is so important. And I love hearing you say that because I haven't even really heard you talk about like medication as an intervention in any of this. So, from your perspective, like do you recommend somebody like go through the 5 M's first for like a certain amount of time and then they maybe go look for medication? Or I know everybody's different, but I just wonder like with your modality and how you approach things, how do you approach that? Is it like let's do the 5 M's first and then see if medication is needed, or where do you go with that?
So
Just
each patient
curious.
treatment plan is catered to their needs. So there are patients
Yeah.
that could respond well with the 5 M's. And that's why we're adding another M's, which is 6 M's, which is
Oh,
medication compliance, right?
okay.
So
I'm on the right track.
medication could be a tool with therapy and the five M's, and we combine them together specifically for patients that are really, really struggling in a severe depression, severe anxiety. That's where in the time we can do and talk about medications. But I think the 5 M's could be a structure for them to keep on repeating so that definitely a medication could also be an option.
I love that. And, I just love nurse practitioners so much more than just regular doctors. Myself, like when I go see a doctor, I just love when I get the nurse practitioner instead because I feel like you guys are like just more well rounded with this stuff, instead of just like, let's just do frontline medication and be done with it. So I think this approach is so important, especially that you're using it to translate into the helping field and help other mental health professionals like be okay. I think it's great. Yeah.
Thank you.
So, okay. So this podcast, a lot of what we talk about in this podcast is sort of like technology and AI and how it can come in and help, help our lives be easier. And yes, it's the berries podcast, but we don't like harp on just berries or anything. So I love to always just talk to our guests and say, how are you using AI maybe in your entrepreneurship or your business itself, or just like how are you seeing it help other clinicians? Like, I'd love to just talk about all of that from your perspective and how you're using it in your world. Yeah.
Thank you so much. AI and technology are rapidly reshaping how clinicians practice, learn,
Hmm.
and care for patients. So, when we use this thoughtfully, these tools can reduce burnout, improve our efficiency, and enhance clinical decision making. But they must always complement, not replace, human connection. And that's very important. And how AI is supporting clinicians today, like me,
Hmm.
clinical documentation and workflow is very important. So if it's an AI assisted documentation, it allows us to reduce time spent on charting, allowing
Yes.
clinicians to focus more on patient care and less on administrative burden. And then also a lot of clinical decision support. AI right now can synthesize large amount of medical data, flag potential drug interactions, highlight guideline based treatment options, and also support safer prescribing, especially in complex fields like psychiatry. Next, education and exam preparation, adaptive and learning programs, question generators, and personalized study tools for the students that helps them pass the board and help clinicians target knowledge gaps, manage test anxiety, and prepare more efficiently for board and certification exams. And of course, mental health screening and monitoring. So there's a lot of digital tools out there that can assist with symptom tracking, early identification of risks, and patient engagement between visits, supporting more proactive care.
Yes, absolutely. I love all of that. Just like a side note, like ChatGPT or something to say, like, give me, like, test me on the knowledge base. And I guess Chat goes out and searches for practice tests out there on the internet. It can actually quiz you, probably, I'm guessing. Yeah.
Yes, it makes our students gets an access to Q banks too, and that's very important.
Ah,
But be careful though. Make sure that this is a peer reviewed questions because sometimes it could be somebody else is doing it. So you need to really make sure to read the validity of the questions.
I was just thinking that because, I mean, AI hallucinates sometimes, so it could just make up weird things. That's so funny. Yeah, that's great. So using AI for all that. So as a nurse practitioner, I'm guessing you've been using berries or tested berries for your own documentation as a nurse practitioner. I use it obviously as a clinician, but how is it for a nurse practitioner? Like, how are you finding it with efficiency and helping you in your practice?
Yes, I think berries improve my time management and also helps me support my work-life balance and decrease burnout related to documentation and efficiency. And I like how simple it is, and I like how friendly it is for clinicians like me, nurse practitioners, and also for the new grads out there. Please make sure to give it a shot. It will make your workflow so much easier.
I can't scream loud enough, but occasionally I run into like supervisors or teachers, they're like, I'm not going to recommend it to my students because I want them to learn how to actually do documentation. But I'm kind of like, in like 10 years, I feel like none of us are even going to like know anything about like actually writing documentation anymore. So I'll be curious to see where it goes.
Yes. And it
you know?
automates your clinical documentation. It personalizes in your style and also supports our EMR and our EHR. So it's really good that it's HIPAA compliant and also the session are captured and there's transcripts on it.
Absolutely. It's amazing. And I don't know if you know this at all, but we are actually launching Berries to be a full EHR. So it's going to like function as the most AI-ified EHR you've ever seen. Like, I'm so
Uh,
excited about it. I'm doing a little plug for it now. Probably by
Ew.
the time this comes out, we will have released the first couple iterations of it, but we are so excited. It's going to change the game for clinicians everywhere. It's really, really exciting. But anyway, that's beside the point. I'm bragging now about berries. So, what about you? Just yourself. Do you have like a wellness practice or something you do every day that you swear by that you could say, this is what I do? And I think if you're going to do one thing at all, it should be this. What would you recommend to somebody listening that's like, okay, I got to get on those 5 M's? Is there something you could recommend?
Yes, I think it's all about also recognizing that self care is very important. So once
Mm.
you practice the 5 M's, you also really need to prioritize yourself because if you don't listen to your body, then your body will try to give up on you. So you really need to make sure you address the body, the mind, and the soul. So I do some meditation early in the morning when I wake up. And then also I make sure that I stay connected with my friends and family that are good for my mental health. And I always make sure that I prioritize myself. And sometimes I have some me time. So I have twins, and
Oh,
they're 18 months. So my wife and me, we make sure that we have some date night with just the two of us, or just me taking some time up with going to the park or watching movie. Alone time, as per se, is also important.
oh my gosh. 18-month-old
18
twins.
months,
Oh,
one boy and one girls. There's Anaya Paris
oh.
and Aiden Cloud.
How cute is that? Oh my gosh, I'm gonna go stalk your Instagram for pictures. I bet they're adorable. So cute. Oh my gosh, I don't know how you get anything done with 18-month-old twins. I mean, we just had a grandchild, our first grandchild, and I mean, we have him for a day and we're wiped out. Like, we need a day of recovery. So that's great. So, what's a common myth about test prep or clinical success that you'd love to bust?
Sure. So the most common myth is that the exam is so easy and then they don't need preparation with it. Yes, you really need to prepare for this exam. This is a doable exam, but it only require you to be entry level and safe practitioner. And that's the whole
Hmm.
point of being board certified. And once you pass your board, you're able to have a lot of opportunities.
Wow. Yeah, that is so true. I couldn't imagine going into it lackadaisical like that, but I'm sure there are people that think I've got this and then they're like sorely mistaken. And so we always do these little quick things at the end of the podcast. So is there a book or podcast that you recommend to your students or your peers that you listen to that has been helpful for you that you could recommend to others?
I have my own podcast. It's called Mindful Moments with Pedro Morante.
Oh,
I
nice.
also talk about mental wellness and platforms to different nursing leaders and also people that are experiencing mental health struggles. So we talk about their
Oh,
PTSD, depression, anxiety, and all throughout. And also nursing leaders are the same as us, right? We can also experience that.
Yes, definitely. Oh, I want to go check that out too. That's great. I love it. So, just to wrap it up, if the listeners take away one thing from today's conversation, whether they're clinicians or students or educators, what do you hope it is that they take from this talk today?
One thing that they can take away from this session is that prioritizing yourself is very important, especially your mental health. If you practice the 6 M's, 5 M's of mental health, as per se, you'll be able to be more productive. You'll be able to have a clear thinking and to have a clear vision, and so that you can perform whatever task you're going to do and whatever dreams that you're going to do is built on a good mental health. So without a good mental health, then your mental or your healthcare outcomes will be poor. So we always need to always pay attention to it. And as a clinician, we always need to make sure that we can use AI tools and we can use different technology to help us reduce burnout syndrome, because that's very important. Before we can take care of our patients very well, is that we need to make sure we are whole and we are listening to what our body is telling us.
Absolutely. Yes. Oh my gosh. And I mean, I just can't scream loud enough to use AI. I mean, people, especially, I don't know about nurse practitioners, but mental health clinicians are still very like anti AI. And it's just like, I just, they don't understand how much it just helps, with everything. So I really hope people are listening to that too. And they give it some sort of AI workflow a chance to help them in their lives and in their professional careers. But anyway, Dr. Morante, thank you so much for being here today. We've really appreciated having you. And where can people find you if they want to connect with you? Where do they go to look for you?
Great. So I have LinkedIn. Make sure you just type my name, Peter Morante. And then you also have Instagram. I have solid followers there. Facebook. I also have YouTube, my Spotify for Mindful Moments with Pedro Morante. And all my information is in the LinkedIn, so you can reach out to me if ever you guys need some guidance in terms of mentorship and also passing your boards, and also in the even your starting your clinical practice and even your preceptorship for those who are Psych NP students out there. So you can reach out to me
Oh,
if
nice.
ever you need to be mentored and be supported.
I love that. Thank you so much. Thanks for taking the time today.